much for coming to this seminar. I must say that I'm very honored to be invited here and to tell you that MIVEGEC and Séminaire are very known, even beyond France. So one of my partners, when I shared the information that I will give a talk today, already knew about your seminar. So today, I'm not going to give a classic presentation of a specific research finding, but I'm going to talk more about the MOOD project that I'm coordinating currently. So the MOOD project is a short name, an acronym of the Monitoring Outbreaks for Disease Surveillance in a Data Science Context. And the purpose of this talk, okay, yes, it is to give a brief presentation of the MOOD, but also to show you that in future we would like this presentation to serve as a basis for future talks that one of my colleagues or multiple of my colleagues will give for topics that may interest you. So the origins of MOOD are related to one concept, and which is the epidemic intelligence concept. So the epidemic intelligence concept, we can say that emerged in the early 2000s with the emergence and the epidemics of several epidemics, such as Ebola and SARS-CoV-2 in several countries across the world. And the weaknesses that were identified by World Health Organization in the managing of those epidemics, especially in the reporting of the outbreaks and the detection of the outbreaks, and of course, as a consequence, the management of the crisis. So that, as a consequence, led to changing the international health regulation in the domain of course, public health in 2005, with a focus of giving attention to countries in the prevention and timeliness in reporting of disease outbreaks, and of course, the secondary step, the control and appropriate public health response, which actually has set up the so-called epidemic intelligence framework that I will explain now. So what is epidemic intelligence? So the epidemic intelligence is the process of monitoring different types of information from different sources, both official, non-official, that I will explain later on. So to detect this information, to verify the information, and that we provide sufficient information for risk assessors so that they can communicate this information to decision makers, and then they can be prepared and take appropriate actions. So concretely, what does this mean? It means that you should have a team that will screen different sources of information, will verify this information if it's true or not true, and then pass this information to another team that will assess the relevance for a given country, and then, if it's necessary, to take some measures. It seems very complicated, and indeed, it's a complicated process. I can tell you that in 2013, we were asked in Syria by the French Ministry of Agriculture to set an epidemic intelligence team that will do exactly the same as I have mentioned before, but in the domain of animal health. And we were one of the first to set up a system that will do monitoring of different sources for the domain of animal health. So CIRAD, with the partners, part of the platform MESA, which is the French platform for epidemic surveillance in animal health, has set up a team that will do this epidemic intelligence activities. So yes, we had to monitor different sources of information, we had to verify this information, and give this information to ANSES that will produce a weekly report, and then DGL, or the French ministry, that will take some appropriate actions. It was mainly meant to focus on diseases that are important, infectious diseases that are important for France, with an aim to prevent introduction of those diseases, such as at the time African swine fever, foot and mouth disease, highly pathogenic avian influenza, etc. However, the problem is more complex, because I mentioned that our job was to monitor a lot of sources. So indeed, there were a lot of sources. So one part were the sources that come from the so-called indicator-based surveillance, which means, well, to have a look at the Official notifications and reports come from OIE, now World Health Organization for Animal Health, ECDC, even World Health Organization. And then to combine this information with the sources that are non-official, such as the ProMed Mail, that is a network of experts across the world that share outbreak-related information, and even going that far to create our own system, our own tool, PADIWeb, that maybe in a later or in another moment during the MIVEGEC Séminaire, I can present in detail. So to create our own tool that will screen Google News, for example, so that we capture information that is important for us, to detect rumors about outbreaks that are important for us at that time. And imagine, I'm giving an example only of the French epidemic intelligence system. At that time, there was an emergence or setting up of several and multiple epidemic intelligence teams across public health agencies and animal health agencies in Europe and maybe beyond. They would collect, analyze, interpret, if it's from the indicator-based surveillance component, or capture, filter, and validate information. Then they will assess this information, and then, as I said, disseminate this information, whether confidentially or publicly, to risk assessors and the decision makers. So, given this massive amount of information, it was a great opportunity when the European Commission in 2019 has launched the call that they are searching for a project or a consortium that could address the multi-source big data that public health agencies are facing when they analyze signals or information for epidemic intelligence, and to propose innovative solutions for them. In this context of global change, climate change, for diseases that are important for Europe. So this call from the European Commission in 2019 was the perfect occasion for us to create the MOVE project, because it was in line with what we faced as a daily work and daily challenge in our epidemic intelligence work. So we won the project in 2020. It's a project of 4 years. It's a research and innovation project, which means that it was asked that we just don't deliver research publications, research output, but also we propose some innovations in the domain of health. So the coordination is from CIRAD, and we have 25 partners across 13 countries from Europe and 1 from the United States, with the International Society of Infectious Diseases through ProMed Mail that I mentioned previously. So our target audience or our innovations are targeting practitioners of epidemic intelligence across public health, animal health, or One Health agencies in Europe. And our approach is, as I mentioned, to develop innovative tools and services for the detection, follow-up, monitoring, and assessment of infectious disease emergence from multi-source big data, given the One Health context, and of course, given the context of global change, climate change for Europe. Our originality is that we proposed in the proposal that we will do our program with a co-conception, meaning that we will involve practitioners at public health agencies and animal health agencies in the process of creation of those tools and services, so that we increase at the end capacity for epidemic intelligence at these agencies and with these practitioners. So if you can see in the figure, at the heart of our project is the co-construction, which also allows us in the project, even though it was defined at the beginning of the when we submitted to the European Commission and beforehand, yes, the entire program, but it gave us a little bit of flexibility with this co-conception, so that we say during the project, yes, we can modify certain things in the project based on the user needs and the co-conception. So the idea is to propose prototypes for disease intelligence using different techniques of modeling and text mining, so that we help, as I mentioned, epidemic intelligence officers at different health agencies across Europe. So our consortium is composed of partners with different competencies, as I mentioned, from modeling, text mining, public health agencies, animal health agencies, spatial data analysis, covariates, etc. So in order to make our program implementable, we have selected a number of countries and diseases to work on. And in order to select the countries and the diseases, we have taken into account the epidemiology of certain diseases, the possibility of emergence, the possibility of introduction of given diseases in Europe, and also the context of global change and climate change. When I say climate change, it's the different factors that are affecting currently Europe, with the increased floodings, rainfalls, increase of temperature at certain regions. So we have selected public health agencies from different regions, given this epidemiology, climate change, global change context, so that they represent these different regions, such as Public Health Finland, Public Health Serbia, Public Health Italy, Public Health Spain, and Veterinary Health in France. Of course, one important stakeholder, if I can say, and collaborator, even though directly not part of the MOOC project, is of course the European Center for Disease Control as a supranational agency. And the new disease models are highly pathogenic avian influenza as a representative of respiratory-borne infectious diseases, West Nile virus, tick-borne encephalitis as the diseases that are present in Europe. Then chikungunya, dengue, Zika as the diseases that can be potentially emerging in Europe, transmitted by exotic pathogens, as we have seen lately with the cases of dengue in France. Then tularemia leptospirosis as neglected endemic diseases in Europe, antimicrobial resistance as a challenge for any system, and diseases. And perfect scenario for us in 2020 was the outbreak of COVID-19, so we use it as a case study. So first thing that we did when we started the project is we constituted a team of researchers that did an extensive state-of-the-art of epidemic intelligence services and systems in Europe. In 2006, when the concept of epidemic intelligence was established, yes, there was the first review of the baseline. Okay, what are the public health agencies doing in Europe? And this was published as a work. But 15 years after, we wanted to know if really health agencies evolved, what they did, what they improved, given this time. And also adding the animal health sector, we wanted to also know, well, what is done in the animal health sector regarding epidemic intelligence. So we did a large-scale survey in 42 countries and territories in Europe, targeting practitioners of epidemic intelligence. And we were asking questions about, okay, what are the data sources that you use for event-based surveillance that I explained previously, or indicator-based surveillance? What is your workflow for detection, verification, and assessment of signals? How do you communicate information? And how do you collaborate both internationally and with other countries or with other sectors within your country? So the preliminary results, I think very soon there will be a publication regarding this work, show that for indicator-based surveillance, practitioners, both in animal and public health sector, they depend a lot on the labs. So the data that comes from the labs. And it shows that it shows the strong role of the labs in the surveillance, and that this infrastructure should be nourished, maintained as an important part of the chain for epidemic intelligence. However, we were surprised that agencies have a limited uptake of event-based surveillance tools. When I say tools, I mean tools such as the web that I mentioned, or the system EOS that was set up by the World Health Organization, or other tools such as Promed Mail. And I think that the justification for this limited uptake is that it adds maybe a lot of noise in their daily work, or maybe not noise, but a lot of additional work, screening of news and information in different sources. And imagine if there is only one person doing epidemic intelligence in a given agency, it's too much work. Then they prefer using scientific literature to do event-based surveillance, and surprisingly, they prefer to use official sources for event-based surveillance, which show that the role of the World Health Organization of Animal Health, ECDC, and the World Health Organization is crucial even for event-based surveillance, even though those organizations were established at the basis for notifying or sharing information for diseases that are regulated by international law for which there are already surveillance systems available and set in place. I can explain if you have questions later on this aspect. And then we also were surprised that agencies answered that they would like to collaborate, but they don't know how to collaborate with regards to sharing information, sharing data with other sectors. Then I mentioned that in the heart of the MOOD project, there is the process of co-conception, and there was a large work of a participatory user need assessment that was done by our sociologists of the consortium that actually complemented the work that I already presented with the survey that targeted a large scale of practitioners. These sociologists and anthropologists, they went and they talked with they interviewed different practitioners. And I will not go into detail with all these numbers, but it's just to show the massive amount of work that they did with interviews, with workshops and meetings, so that they capture their needs regarding tools, services, regarding epidemic intelligence. And of course, what are their problems? And the results showed in our project that, again, it's very interesting because it's complementary to what I already presented before with our survey, that epidemic intelligence practitioners, they would like to review their epidemic intelligence strategy because they feel that, well, they would like to be better prepared for new and emerging disease threat outbreaks. They would like to adapt their routines because they would like to manage the increasing amount of data they have with the different tools at their disposal, and to have a better methodological support for the intersectoral analysis. And as I mentioned, they would like to, but they don't know how in reality how to implement this collaboration. And of course, another bottleneck that we assessed and that we found out is that epidemic intelligence practitioners want to have more complete and integrated data flows and access to data flows, which is still a challenge in many countries and for many agencies. And they would also like to have not everything automatic, because they still believe that the human interpretation, the human verification is still important for visualization, for analytics of all the detected signals, for example, of disease emergence. And of course, to have harmonization and more integrated approach between agencies and sectors, such as sharing tools, data, and covariance. So just to summarize what I already said, is that we understood in the project that whatever we propose, it should focus not just on the tools for early detection of health events, but also to propose a list or set of covariates and some contextual information so that epidemic intelligence practitioners can use as a background information so that they can evaluate this information and provide better on risk assessment. Like that, their workload will be decreased and they will better use the different sources and methods for epidemic intelligence. So, after all these exchanges, workshops, meetings, prioritization of problems, in the MOOD consortium, we have decided that we should create a platform like a tool, like an access for health agencies that will allow a better detection, monitoring, and follow-up of disease emergence for the list of diseases that I mentioned for Europe. And this platform that is currently being created should be composed of 3 modules. So the first module will allow practitioners to visualize, to download standard and relevant covariates for the model diseases. And it will allow them to support risk assessment and modeling. So I will go, click, explore different covariates such as temperature, rainfall for Europe, or administrative level, and I can download this information that I can use after for my, as I mentioned, risk assessment or even modeling. Then the second module, it's a module that will focus on, well, the improved visualization and analytics of all the information that we will capture from media. As I mentioned before, one of the challenges of cross teachers is that, well, I need to click on the health map website, I need to go and check from a mail, I would like to consult information from another source, but it's too much time consuming. I would like to have one platform where I would, or one tool where I would visualize different sources of information. I can explore this information and I can download so that I can use for my risk assessment purposes. So this part has been developed by our partner, which is called Elena, that you already all know. It's the laboratory for informatics from the University of Montpellier. And the third part is a disease-specific part. So here, different groups of modelers from different partner institutions, they will develop models using official data from the European Center for Disease Control or the World Health Organization or WOA, and in addition, media data, so that they can provide risk maps that a risk assessor, epidemiologist, epidemic intelligence practitioner can use for supporting surveillance plans, for example. And the idea is that these maps are updated once a year, so that they have a use, not to have a static map. We produce maps, we produce results, and it's finished, but for them to be updated and useful for future for the epidemiologists. So in order to make the realization more efficient, for each module and for each case study, we have designated a contact point, if I can call a facilitator. So for example, for highly pathogenic avian influenza, the reference point is at ULB, University of Bruxelles. They're developing models for highly pathogenic avian influenza. Of course, there are collaborating partners such as Terra that contributes in this main component, and other partners, but let's say the reference is this institute. Or for tick-borne encephalitis, the reference institution is the Public Health Finland, with collaborators such as Fondazione Edmund Mar, INRAE, etc. For COVID-19, here it's through mood at the end of the project will be to outline the lessons learned. And of course, all the tools, services, methods are already available for public health agencies and across literature for this disease model. Regarding West Nile, it's the FOM that I mentioned before that is in charge, and other partner institutes such as ULB, Lille Serran. For IMR, we have the Institute of Tropical Medicine in Belgium, and as a person in charge, but also the Technical University of Zurich with the group of Thomas Van Bokel doing an impressive job. Then for tularemia and leptospirosis and for chikungunya, dengue, and Zika, the leadership for this modeling work will stay in Sierra. So I can present in detail, if you have any questions, the different modeling works that are done in the different case studies. But I would like to use this opportunity, as I mentioned at the beginning of the talk, that in a series of future talks, the reference people from these groups come and present the research results, especially regarding modeling and how they include climate change, global change in their models to produce the different outputs. Another point that I would like to mention is that, yes, we are a research project, but still we wanted at the end of the project to produce the tools and services that will be sustainable beyond the mood project. And that's why we have engaged that we will, by the end of the project, set a mood foundation so that it can continue to live and promote the tools and services when the project terminates. So we have the budget for setting up this foundation. So some other main achievements that may be of interest to you. I don't know how much time I have left. Oh, you have the time. So we have, as of October 2022, 65 publications. I can say that the first 2 years were mainly related to COVID, all the activities, all the modeling work that has been done, again, as a contribution, as a collaboration with many public health agencies to control the pandemic. And in 2022, other topics are emerging. The modelers, of course, are working on their disease models since the beginning, but the real fruits, let's say, are emerging now in 2022 regarding West Nile, tick-borne encephalitis, hopefully very soon, highly pathogenic avian influenza, etc. So besides the publications, as I said, we had an immense work of workshops, meetings with potential end users from countries in Europe, not only the 5 countries that I mentioned that are, let's say, obligatory, because they are partners of the MOOD project, but much more than that. In the MOOD project, we also, like you, organize the science webinars. We try to keep them now once every 2 months, because we don't want to overcharge people with too many events. And we therefore compensate with the monthly newsletters, where we produce our main achievements. I mean, we publish our main achievements and research outputs. So another interesting point is that I mentioned the MOOD platform. So hopefully by the 14th of December, our developers at Lirama, and I didn't mention Avia GIS at Belgium, which is in charge of the component of covariates. So the 2 generic modules, covariates and visualization of event-based data and epidemiological data, will be presented on the 14th of December at 1 p.m. Central European time. So I invite you, if you're very much interested, to see what the MOOD platform and especially the generic part will look like to assist our demo, and of course to provide suggestions. Another interesting work that we're doing in MOOD that I'm very proud of is the MOOD Summer School. So the MOOD Summer School is organized yearly by OpenGeoHub, which is a non-for-profit foundation partner of the MOOD project, situated in Wageningen in the Netherlands. And they're experts in organizing summer schools, but beyond that, they have strong competencies in data science, geomatics, geostatistics, not just known in Europe, but worldwide. So last year with them, we organized a 3-day, last year, actually this year, this summer, we organized the first MOOD summer school in Montpellier. It was a 3-day event oriented around data science, analysis of epidemiological data, both by sharing the data and the code. So it was a perfect opportunity for postdocs, PhD students, researchers, well, to learn new methods, but also to network for future collaborations. Our next MOOD summer school will be a 5-day event. It's planned for the beautiful city of Split in Croatia. And again, we aim to invite top researchers that can provide, again, the data, the code for some innovative, interesting modeling work that they did using R. So I invite you, if you're interested, to write me. And I think even the call for interest is open. And following this link, following this link, you can see the lectures from the 2022 summer school. But if you contact me, I can provide you with more information how to join or how to subscribe for the 2023 summer school. Another opportunity for you to attend is the MOOD General Assembly, which we plan to hold in Helsinki, the Finnish Institute for Health and Welfare, so the public health, actually, Institute of Finland in June next week. So indeed, it will be a more internal meeting of the consortium, but we plan to have 1 day of scientific, if I can call a workshop, where if you're a scientist and if you have interesting results to present from your work regarding climate change, global change, infectious disease emergence for Europe, of importance to Europe, you're welcome to write me, and we can make sure that your fees traveling presence and your presentation is well, it's available to our consortium. Both we will favor in presence, and if you would not be possible, so by video. Of course, we plan at that moment to have a more advanced version of the Mood platform so that we test in person with some of the end users. So in December, it will be more demo with some questions, suggestions, and then in June next year, then demo plus testing with the end users. So this is one of my last slides. So I kindly ask you if you have time to have a look at the Mood website, which is maintained weekly with a lot of interesting information. Just subscribe to our monthly newsletter. We have a LinkedIn, Twitter accounts, and if you have any questions, and again, if you want to enroll summer school, join our Mood General Assembly meeting, please don't hesitate to write. So as I mentioned at the beginning, I think the Mood researchers will be very happy to present their detailed research results per topic in the months to follow. So we will be in touch. And I thank you for the attention and happy to answer any questions if you have.
So you can ask questions in the room, but also in the chat room. It's they to write in the chat if you have a question.
It will be a really naive question because I'm not in that kind of project. I'm more or less in the immunologist, but not looking at epidemics.
Neurologist?
Immunologist. So my question is regarding to the labs that are involved in these projects. Are they public health laboratories or private ones?
No. It's public health, and it's not labs. Yeah, it's more agencies. So it means that mainly their work is to centralize some information that is sent by epidemiological information on outbreak cases for certain diseases that is sent by labs. So sometimes, yes, a given agency is also a reference laboratory, but in some situations, it's just an agency or an administrative and of course epidemiological staff, epidemiology staff that centralized information, creates surveillance plans, control plans, provides risk assessment, depends on the agency. So no, part of the project are not national labs, it's the agencies.
Yeah, then so the agencies are making links with labs.
Yes.
And these labs are from institutional labs?
Yes, they're institutional labs. I have no information if they use. It's an interesting question. I have no information if the current epidemic intelligence, even at national level, uses information from labs that are not institutional or official or governmental.
Yeah.
I don't have this information, and I don't think that we asked this question to the. No, we don't. I thought maybe it's a perspective for another survey, for another research to ask, okay, how much this information is used for epidemic intelligence. We don't know.
Yeah, because your sources, if they are really well diffused, I mean, in the whole country, or they are just using a kind of labs. I mean, if they are
okay, so
just
maybe
identify which kind of labs. So I mean, yeah,
I was maybe not so clear at the beginning. When we, for example, I can give the example of the French epidemic intelligence system for international health. So it's a team of 2 people working full time. That their job is to monitor. So like, actually they don't work in the lab. They would just like to have access to different sources, such as I mentioned, the notifications from the ADIS system, which is the system for disease notification from the European Commission on animal health. Does not cover all the diseases, so go there, they check for certain diseases, because it's more complete than the information in the World Health Organization for Animal Health. Then they go to the other side. Then, if it's a disease of public health concern, maybe they will go to the ECDC site, or that's it. Then, to complement this information, they would check the information in PADIWeb. So it's a tool that we developed in Sierra to screen Google News for given diseases. We use it now even in Mood. And then maybe other sources such as from a mail alert. So that is what they do daily. And I think that in many agencies, and that's what our survey shows, that in many agencies, they have people that are trained or not. They're just given the responsibility to do this monitoring by saying, we do epidemic intelligence, we want to work on the preparedness.
Yeah.
But it shows that there are still improvements to be made. Any other questions? I don't see any questions in the chat.
No, they are shy today.
Or maybe I was not interesting enough. I'm sorry.
Very interesting. Question?
Okay, well, thank you very much for attending the presentation, and I'll see you soon with one of my colleagues.